Are you suffering from rheumatoid arthritis and you are in the process of planning a pregnancy? Then you should watch this video. As you probably know, females are more likely to develop rheumatoid arthritis during childbearing age. In this video, I will guide you and I will help you prepare for a healthy pregnancy if you suffer with rheumatoid arthritis. And we will discuss if you should use contraceptives during rheumatoid arthritis. We will discuss what are the most important aspects that you have to take in consideration before a pregnancy, if rheumatoid arthritis will increase the risk for miscarriages. We will discuss what are the drugs that are contraindicated during pregnancy and what are the drugs that are safe during pregnancy if you suffer from rheumatoid arthritis.
Rheumatologist OnCall.com.
Should you use contraceptives when you have rheumatoid arthritis? Females with rheumatoid arthritis should avoid getting pregnant until they are ready. An unintended pregnancy can lead to adverse outcomes for the mother but also for the baby. So it is advised to use effective contraceptives along with prescribed rheumatoid arthritis medications such as leflunomide or Methotrexate. Planning a pregnancy while having rheumatoid arthritis is very important. If you plan to have a baby, you should have your disease under control for at least 3 to 6 months before you try to conceive. And that will reduce the chances of complications during pregnancies and complications for your baby. So, you should have no pain, no swelling, no stiffness in your joints. You should not have frequent flare-ups of rheumatoid arthritis before you get pregnant. Some females can get longer to remain pregnant because of multiple reasons. Most of the time, irregular ovulation and lowered sex drive because of fatigue and because of pain. As with females without these conditions, some of you may need to have physician-assisted pregnancies procedures, including medication or in vitro fertilization or even insemination. In many cases, your medication needs to be adjusted. Why? Because certain drugs can hurt the fetus. Some medications actually need a washout period before you conceive a baby. Now let me give you an example. Methotrexate can lead to serious fetal defects in pregnant females. Now the data in males showed no reduction in fertility of those that were taking doses that we use in rheumatic diseases up to 20 milligrams once per week. Leflunomide also needs a washout period before you try to conceive. Some researchers actually suggest that this washout period to be up to 2 years. Medications such as Methotrexate and leflunomide must be stopped at least 3 months before you consider to conceive, as they can cause, as I said, fetal defects. So, as soon as you decide to have a baby, discuss with your rheumatologist to make these necessary changes. The rheumatologist will know and will help you decide on the treatment during the time of your pregnancy. So as soon as you decide to have a baby, you should discuss that with your rheumatologist to make these necessary changes in your treatment. The physician will help you decide on which treatment is good for you to manage rheumatoid arthritis during pregnancy, and in this way you will ensure the safety of your future baby. You should also follow up closely with your rheumatologist before and during the pregnancy. Does rheumatoid arthritis increase the risk of miscarriages? Miscarriages can happen in any pregnancy for different reasons. But scientific studies report that the rate of miscarriage in females with rheumatoid arthritis is similar to those that do not have this disease. Can you have a healthy pregnancy with rheumatoid arthritis? Now, the situation varies from female to female. In some females suffering from rheumatoid arthritis, the disease activity actually improves during pregnancy. On the other hand, there are some females where the disease remains active or becomes worse. So that's why it is necessary to seek the help of a rheumatologist to have a treatment plan that will control flare-ups and will minimize the flare-ups effect on the developing baby. What are the medications that are contraindicated in pregnancy if you suffer from rheumatoid arthritis? Patients with rheumatoid arthritis planning to have a baby should stop the following medications. Methotrexate. Whether the treatment is oral or injectable, methotrexate should be stopped as it can cause severe malformations. Leflunomide. Some researchers believe that a Reva or leflunomide can persist in your body for up to 2 years, but the recommendation is to stop it at least 3 months before you try to conceive. Like methotrexate, leflunomide can affect your baby, causing malformations. High doses of steroids. Using prednisone in doses more than 20 milligrams per day can also negatively impact you as a mother and also the baby. You may develop gestational diabetes while your baby may come too early, preterm delivery, or may have a very low weight at the time of the delivery, which can put the baby at higher risk. Most importantly, you should consult your rheumatologist before stopping or changing your treatment. What are the drugs that are safe during pregnancy in rheumatoid arthritis patients? Rheumatoid arthritis medications that are reported to be safe during pregnancy include hydroxychloroquine or Plaquenil. This was not reported to be harmful to the mother of the fetus. Sulfasalazine, again, was not reported to cause an effect during pregnancy. TNF-alpha inhibitors such as adalimumab or Humira, etanercept or Enbrel, certolizumab or Cimzia, and golimumab or Simponi. Tumor necrosis factor alpha inhibitors or blockers may be used in females who require these medications to control the disease during pregnancy. Some experts suggest that this medication should be discontinued in the late second or third trimester of the pregnancy. However, if you need to continue these drugs, they can be extended to a later gestational age if those benefits outweigh the potential risk. Certolizumab or Cimzia is the only TNF inhibitor that was suggested to be compatible for use throughout the pregnancy. We do have limited information about the use of golimumab. After the baby is delivered, the infants exposed to TNF-alpha inhibitors while the mother was pregnant should avoid live vaccines like BCG, live rotavirus, measles, mumps, rubella, and live polio vaccine during the first 6 months of their life. Now, serious infections were not reported in babies from pregnant females exposed to TNF-alpha inhibitors. During breastfeeding, you can continue TNF-alpha inhibitors as these drugs are large molecules that pass into the breast milk in very small quantities. However, this data is limited by small numbers of studies exploring pregnancy and rheumatoid arthritis. More data is required to better assess the safety of all of these drugs in pregnancy. Tips for managing rheumatoid arthritis during and after pregnancy. Now let me give you some tips that you can use during pregnancy and in the months that will follow. It is very important to monitor your weight. During pregnancy, the added body weight puts more pressure on your joints, so it will be best if you avoid gaining a lot of weight. Get your nutrition. Rheumatoid arthritis medications can cause bone thinning, so you need vitamin D and calcium to prevent this condition. I do recommend you to get a healthy diet full of fresh and organic fruits, vegetables, and whole grains while you should limit your consumption of unhealthy fats. So again, it is very important to be in contact with a rheumatologist during pregnancy and after pregnancy. Your physician can help you navigate this period of your life and can help you manage the symptoms of rheumatoid arthritis before, during the pregnancy, and after the pregnancy. That is all about rheumatoid arthritis and how you should manage that during pregnancy. If you have any questions or if you'd like to share your experience, leave a comment below, and don't forget to like, share, and subscribe for more informative videos about rheumatoid arthritis. Thank you and have a wonderful day.
Rheumatologist OnCall.com